We'll try to do an anatomy question. 72-year-old woman present to emergency department after feeling a pop in her left side hip. She recently underwent a left side total hip replacement. You suspect hip dislocation. Which of the following statement is incorrect regarding extracapsular ligament? Here we need to know about extracapsular ligaments. Statement A is, there are two main extracapsular ligaments stabilizing the hip joints. There are three main extracapsular ligaments, not two. Those are iliofemoral extracapsular ligament, pubofemoral extracapsular ligament, and ischiofemoral extracapsular ligament. So statement A is incorrect. Statement B is, iliofemoral ligament is the strongest of extracapsular ligaments. That statement is correct. Iliofemoral ligament is the strongest and largest extracapsular ligament of hip joint. Statement C is, pubofemoral ligament is antero-inferior to hip joint. That statement also true. Iliofemoral ligament is anterior and superior to hip joint, and ischiofemoral ligament is posterior to hip joint. So statement D, it says ischiofemoral ligament is posterior to hip. So that is correct. And the last one is, extracapsular ligaments all act to prevent excessive extension of hip joint. Here we need to know about the function of extracapsular ligaments. Iliofemoral ligament is prevent excessive extension as well as lateral rotation of hip. And pubofemoral ligament is preventing excessive extension of hip joint as well as abduction of hip joint. And ischiofemoral ligament is preventing excessive extension of hip joint and excessive medial rotation of hip joint. Iliofemoral extracapsular ligament arises from ilium just below the antero-inferior iliac spine. Distally, it attached to intertrochanteric line of femur. Pubofemoral ligament, which arises from iliopubic eminence and adjacent bone. Distally, it attached to, it's a blend with capsule of hip. And ischiofemoral ligament, which arises from ischium, and distally it attached with greater trochanter of femur. If you see the intracapsular ligament of hip joint, which is called ligamentum teres, which arises from fovea on the head of the femur, and it carries acetabular branches of obturator nerve.